This brief video is supported by the Washoe County Health District and the Nevada Governor's Council on Developmental Disabilities through grant funds. This training is designed to provide basic tips for the first responders when responding to individuals with intellectual and/or developmental disabilities, or IDD. Nearly 20% of the population of the United States has some form of a disability. That's about 56.7 million people. Here are some general tips to remember when responding to a call for an individual that has IDD. Use people-first language. They're a person first and foremost. Remember, they are a person with autism or a person who is blind, not the autistic man or the blind kid. You can also follow their lead and listen to how they describe themselves and use similar language if it's respectful to themselves and others. Be cognizant of family and caregivers. They may be a good resource for gathering information. Avoid raising your voice to a person you suspect is hard of hearing unless they ask you to speak louder. If someone has a hearing aid and you speak loudly, it may hurt them. Or if someone is very hard of hearing, they may only use sign language and raising your voice won't help. Take your time and use simple language. Unless the person is a child, don't treat them like a child. Remember, they are adults and treat them as such, which includes speaking directly to the individual and not talking about and around them with caregivers or interpreters. Be prepared for service animals. They are legally allowed to accompany people with disabilities in all areas where the public is normally allowed to go. More info on service animals can be found at the link provided below. The reason they are calling 911 may be completely unrelated to the existing condition. Don't assume the reason for your response is related to their disability. There are common characteristics of disabilities that can aid in your response approach. However, Dr. Stephen Shore states, once you've met one person with autism, you've met one person with autism. Individuals with disabilities are unique. Not all people will exhibit all characteristics. The next slides are general suggestions for responding to individuals who have special needs or disabilities. Autism is a spectrum disorder with a range of conditions characterized by challenges with social skills, sensory stimuli, repetitive behaviors, speech, and nonverbal communication. On an initial impression, the individual may appear to lack coordination or exhibit behaviors that resemble someone who is intoxicated. People with autism may have difficulty understanding and answering questions as well as recognizing figurative language like sarcasm, irony, or wordplay. They may also not recognize or understand nonverbal communication such as body language, facial expressions, and tone of voice. Ask permission before you touch them and tell them what you plan to do before you do it. Be ready to give an explicit explanation as to why your actions are necessary. Since anxiety and confusion as well as reactions to sensory stimuli can be severe, this may result in the individual trying to leave the scene or refusing care or treatment. It's important to use concrete or literal language and avoid figurative language. For example, it may be common to ask a person with diabetes if they have trouble with their sugar. This may confuse a person with autism as they're thinking about the sugar in their kitchen that they use in their coffee. Be prepared for meltdowns from too much sensory input, or the presence of stimming, which is self-soothing, repetitive actions. These actions are out of the person's control and should not be misinterpreted as aggression or try to be stopped. Give them additional time to process verbal questions or instructions as well as the situation as a whole. Cerebral palsy is a neurological disorder caused by a chronic, non-progressive brain injury that occurs during the pre- or postnatal period. It affects body movement, muscle coordination, balance, and posture. In addition, people with cerebral palsy may have associated conditions such as intellectual disability, seizures, and vision or hearing loss. As with autism, people with cerebral palsy may range from mildly affected to significantly impacted, including severe difficulty with speaking and controlling movement. People with cerebral palsy can have severe seizure-like tremors of their torso and limbs, paralysis, paresis, contractures, and/or rigidity of their limbs and joints, and difficulty with controlling their fine motor muscles to be able to speak clearly or at all, or swallow effectively and safely. These characteristics can make it difficult to conduct an assessment of the situation. Individuals with cerebral palsy may be unable to bend or straighten their limbs. Be especially cautious when moving them. Spina bifida is a congenital birth defect where the spinal column doesn't close completely during fetal development, resulting in the spinal cord being exposed outside the body. Although the visible defect is typically corrected shortly after birth, the damage to the spinal cord prior to delivery can result in paresis or paralysis of the legs and torso. In addition, people with spina bifida can have Chiari malformations, which is brain tissue extending into the spinal canal, often requiring a cranial shunt, as well as bowel and bladder control problems, seizures, malformed feet, uneven hips, and scoliosis. People with spina bifida also have an increased risk of having a latex allergy. They're also at an increased risk for limb and spinal injury after a trauma, so give extra consideration to splinting and spinal precautions after a traumatic event. When planning for transport, the suggestions are similar for people with cerebral palsy. Ask the person or caregivers for the most appropriate way to move the person safely and comfortably. Down syndrome is a congenital disability due to a full or partial extra copy of the 21st chromosome. Some common physical traits of Down syndrome are low muscle tone, small stature, an upward slant to the eyes, and a single deep crease across the center of the palm. Each person with Down syndrome is a unique individual and may possess these characteristics to different degrees or not at all. Down syndrome is often associated with several medical problems including leukemia, early onset Alzheimer's disease, osteoporosis, sleep apnea, cataracts, and congenital heart defects. These individuals may also be more sensitive to medications. When responding to individuals with Down syndrome, slow down when speaking and give them additional processing time. It may be difficult for them to follow multiple directions at once. Try showing rather than telling. Being positive will encourage success. An intellectual disability is defined as an IQ less than 70 and concurrent deficits in adaptive behaviors, such as age-appropriate self-care and independence. 84% of individuals with an intellectual disability have a comorbid mental health disorder or physical disability, or both, with a large majority also showing verbal and physical aggression. People with an intellectual disability may have difficulty with communication, including limited speech and language. They may be susceptible to overstimulation, agitation, confusion, or misunderstanding, especially when experiencing a medical or other traumatic emergency. You may have a difficult time sorting out the complaint or getting a complete history of the incident. Be prepared to ask about and address both medical and behavioral issues, and encourage family or caregivers to stay with the individual to help with communication. When speaking to individuals with an intellectual disability, consider your language usage. Listen to how the family or caregivers speak to the person and adjust the complexity of the language. In addition, be sensitive to nonverbal cues indicating anxiety or concern and explain everything before doing it, even if they appear to not understand. People with sensory disabilities often have limited or loss of one of the 5 senses, the most common being sight or hearing. Children and adults with blindness are defined as having varying degrees of vision loss and may have limited vision even if legally blind. Provide a person with limited vision as much verbal support as possible, being very sure to advise them before each time you touch them, move them, or perform a procedure. Children will be highly tactile, so let them touch things before using them, if appropriate and practical, but keep in mind that young children will be more likely to put things in their mouths. Many people who are considered deaf are able to hear some things, but likely won't be able to hear speech. Writing and gesturing may be effective for simple communication. Contrary to popular belief, lip reading may not be an effective method of communication. However, remember to face the person when speaking to them, as this can provide nonverbal facial cues. It seems obvious, but it's very easy to turn away from someone while speaking without realizing it. Speak directly to the person who is deaf or hard of hearing, not to the interpreters and family or friends. Speak clearly without shouting or exaggerating mouth or lip movements. Use gestures and facial expressions to help convey meaning. The most important thing to remember when responding to individuals with disabilities is that they are people first. Use good assessment practices as you would with any other individual, and use their knowledge and that of their families about their condition to help make good decisions on their behalf. Thank you for watching. We hope these tips are beneficial to you and the community you serve.